Hi, I'm Danny McGoldrick, Vice President of the Global Health Advocacy Incubator in Washington, D.C. We're really sorry to miss being with everyone at the conference, but thanks for joining us as we share lessons we've learned about mobilizing local civil society to advocate for policy change to improve health and healthcare. Global health leaders have united around the goal of universal health coverage and have emphasized the importance of national ownership and the primary role and responsibility of governments. In-country advocacy, led by local and national civil society, will determine whether or not this ambitious vision for universal health coverage is realized. To achieve universal health coverage, advocacy will be necessary to create and sustain the political will to allocate resources for care, to provide services and programs, and to pass policies that not only save lives, but reduce the cost to government of providing health care. The Global Health Advocacy Incubator works with local civil society organizations across a wide range of public health issues to pass laws that save lives and healthcare dollars. We've helped partners pass the Philippines' first child restraint law, built public support for a new sugary drink tax adopted in South Africa, and helped convince the Tanzanian government to assume responsibility for a highly successful maternal and reproductive health program. This presentation will share the approach we've taken to help civil society organizations win policy victories to improve health and health care. In each of these cases, and many others across a wide range of political systems and geographies, we follow a consistent approach, identifying civil society organizations, assessing and building their advocacy capacity, and guiding them through the planning and executing of strategic advocacy campaigns to achieve important public health victories. Thank you again for joining us. We'd love to hear what you think about us and our approach after you watch the presentation. And in particular, we look forward to the opportunity to work with all of you to improve healthcare and provide healthcare for all. The Global Health Advocacy Incubator supports civil society organizations who advocate for public health policies that reduce death and disease. We bring a proven advocacy approach and a global network of local partners built on a 20-year track record of success across multiple issues in more than 60 countries. Our history began in tobacco control, first in the US with multiple wins on tobacco taxes, smoke-free laws, marketing restrictions, and other efforts to reduce tobacco use, and then globally as part of the Bloomberg Initiative to reduce tobacco use, again, passing policies around the globe in a number of countries and a variety of political systems. Since 2014, with the launch of our Global Health Advocacy Incubator, we've taken that advocacy approach and applied it to a number of other key public health issues in dozens of countries. These include cardiovascular health, civil registration and vital statistics, drowning prevention, maternal and reproductive health, obesity prevention, preventing epidemics, road safety, and violence against women. We bring a proven advocacy approach and a global network of local partners built on this 20-year track record of success across multiple issues in more than 60 countries. During that time, we've supported over 250 organizations to help them plan and implement locally led advocacy campaigns to change public policy. We've provided technical assistance and support to more than 15,000 advocates and journalists around the world. And during that time, our efforts have helped with the passage of over 250 public health policies that are saving lives and reducing healthcare costs around the world. Why do we focus on policy change? Basically, because it works. We believe policy change is critical to achieving significant improvement in public health because of its base in evidence, its population-based impact, its relative cost efficiency when you compare it to individual behavior change campaigns, and its impact on social norm change. Taken together, these impacts result in behavior change, which leads to lives saved and reduced healthcare costs. Our principles: we believe policy change has to be locally led and sustained. This is our philosophical belief, but also a practical one, because it's the only way to get policy change done. we work to enhance the ability of local advocates to create the change that they envision. We also believe that advocacy is best learned by doing it. We don't just do one-off trainings and send people on their ways. Rather, we build their capacity for advocacy and we work with them along the way as they plan and execute campaigns. Our technical assistance and our mentoring and capacity building build on a common approach, but are customized to the local political culture and larger culture in the countries in which we work. And we're always looking to improve our work. We capture and share global best practices for advocacy. We create opportunities for our partners across countries and across issues to learn from one another. And we're always looking to learn from our local partners on how we can improve our advocacy efforts. Finally, we know that advocacy doesn't always achieve immediate success. Persistence is key, and we don't quit. We keep going back and working until we get decision makers to adopt the policy changes that the science tells us will improve health, save lives, and save healthcare dollars. How do we go about implementing our approach with our local partners? It all begins with capacity building. We know that strong advocates are the key to passing strong policies. So once we've identified potential local partners, capacity building of our partners is integrated into our overall campaign strategy. First, we have to assess the organizational capacity across the multiple advocacy domains that are part of a campaign plan, whether that's influencing policymakers, media advocacy, coalition building, etc. We measure and document our capacity strengthening as a core programmatic outcome. So we're not just looking at building capacity, but we're looking at it in the context of a campaign and how that leads to success in achieving policy victories. And we develop interventions to address gaps in advocacy capacity and to maximize strengths across our partners in a given country. We develop a capacity building plan and implement it, including both trainings and, as I said earlier, learning by doing throughout the course of a campaign. Our advocacy approach can be summarized in 4 key steps. First, working with people on the ground, partners on the ground, we have to assess the political environment, civil society, and the media environment in a country where we're going to be working. We have to find those critical local partners, get them resources, and assess and build their advocacy capacity. Then we have to plan for our campaigns. We do legal and policy analysis, political mapping, and all of this leads to a strategic plan for advocacy to engage policymakers, conduct media advocacy, build strong and passionate coalitions. And finally, we know that campaigns don't end with the passage of the law. We also have to advocate for governments to implement and enforce those laws when they adopt them. Just a few quick notes on our approach specifically. We have to conduct legal and policy analysis to know where the gaps in the laws are and how we can translate best practices for policy into a country's legal and legislative system. So we analyze the current laws to identify gaps, we assist in legislative review, and we're also, when our opponents are offering amendments or new legislation, we critique it and make sure that policymakers know what best practices are on our particular issues. Political mapping is critical. We have to map out with local partners not only the process of passing the law, but who the key decision makers are, who the key players are in every stage of the policymaking process, as well as who their key influencers are and how we can best get our message to the key decision makers throughout the process. We have to understand the stakeholders that are affected by the policy, including those who oppose, so we can engage supporters on our side and try to neutralize opponents. We conduct advocacy-focused research to make sure that our local partners establish themselves as the information resource on the issue for media and policymakers, providing evidence on the problems, the causes, and the solutions. Our local partners and global partners conduct primary and secondary research to support advocacy. So we can create materials that make the case for the policies, again, laying out the problem, cause, and solutions. And so we can also understand how the public feels about our issues, and we can communicate that to the media and policymakers as well. All of this research and planning leads to a strategic advocacy plan, a dynamic one that is updated regularly based on the latest intelligence about what's going on in the country in the decision-making process. This starts with a clear policy objectives and then outlines in detail the strategies and activities to achieve success in our advocacy campaign. These include the targets and objectives of those strategies, the timelines for conducting the activities, who is responsible for doing it, by when they will conduct these activities, and measures of success. Are we putting in place those major building blocks of an advocacy campaign, and are they at each of those activities achieving their objectives? Then we work with our partners to implement and execute that strategic advocacy campaign plan. This includes engaging policymakers, where we're building political support through targeted policymaker outreach, individual meetings, meetings from influentials that we've identified in the political mapping, and engaging stakeholders and making sure their voices are heard as well. So we have to know who our targets are, develop persuasive messages, be a resource for them with information and knowledge about where things are in the process. We want to create a supportive media environment for decision makers, and so they're hearing about our issue, and we have to demonstrate public support so they know that the public supports the policy change that we are advocating for. Media advocacy and communications are a huge part of our advocacy campaigns. We have to use media creatively and proactively to create a media environment that's conducive to policy change. That means that the public and decision makers are hearing about the importance of our issue and the urgency of taking action. So we have to develop persuasive materials, and we have to be creative in getting our story out there through media advocacy to make sure, again, that both the awareness of the issue is high and the urgency to take action as well, using owned, paid social media as well as earned media, being nimble so we can respond to crises and opposition attacks, and also educating journalists about how they can report on the issue and help get the word out. Building and mobilizing public support is also a critical part of these campaigns. We know that, especially when there's strong opposition, that we have to build a diverse coalition based on stakeholders and influence and mobilize these groups to make their voices heard to the public and policymakers who are on the right side of our issues and who support change that will improve public health and save lives. We can also build a base of individuals and activate them at key moments. So they're reaching out to their policymakers to tell them that they care about the issues and they want them to act in the interest of public health. Our approach has led to success on a number of issues in a variety of countries now. In the 6+ years we've been working on these issues with the Advocacy Incubator. We worked on a campaign in the Philippines where we worked with local organizations to build their capacity, where they became the go-to coalition for information on child restraints, and were successful in passing the first child restraint law in the Philippines, and are now working on advocacy to make sure that that child restraint law is implemented and enforced moving forward. In Tanzania, we worked with local advocates to get the government to take ownership of a transformative reproductive health campaign that provided essential services to pregnant women. This was an effort to transition the program from private funding to government funding, and in 2019 led to an agreement by the government to take over this highly effective program. And in South Africa, we helped raise awareness and support policymakers who were advancing a tax on sugary drinks to reduce the consumption of these unhealthy beverages in South Africa, which led to the passage of this law in 2017. It went into effect in 2018. We'd love to work together with you and partner on advancing policy change that can improve health and healthcare.
The Global Health Advocacy Incubator supports civil society organizations who advocate for public health policies that reduce death and disease. We work in dozens of countries around the world on a variety of public health issues across all political systems. Our advocacy in-country coordinators support locally led policy change campaigns. Here are a few members of our amazing team.
Hello, I am Lopa Ghosh. I live in India. In India, I fight for cardiovascular health.
I'm Hemala Laos. I live in Colombia, and I'm fighting for having safer vehicles in our country.
I am Emmanuel. I come from Nigeria. I work on the Prevention Epidemics program.
Hi, my name is Mariana. I'm from Brazil. I work for the obesity prevention program.
My name is Nkiru Mwadioke. I live in Nigeria.
Hello, my name is Fan Lo, and I live in China.
Hola, my name is Lorena. I'm from Colombia. I'm the in-country advocacy coordinator, and we work around all the topics to prevent obesity.
Hi, my name is Rachel. I live in Jamaica but work in Jamaica and Barbados.
And we fight for healthy food environments.
And I fight for road safety.
I'm proud that our work in Nigeria is making a huge change and saving lives.
Super proud of the work that we do in Brazil because we have very, very committed advocates in the ground.
I'm proud of our work because you can really see the impact that it has on the day-to-day lives.
And I'm proud of our work because through this we are going to save millions of lives, and we are going to create a nation that is healthier and more prosperous.
Proud of our work because we are helping more than 60 countries around the world in having better policies to save lives, to change people's lives, and to have healthier societies.